For Hywel Dda University Health Board. Thank you for joining the call this morning. This is an extraordinary meeting of the board, and our purpose is to receive the annual report and accounts, to approve them and to sign them off. I'd like to begin with our apologies. We've received apologies from Michael Imperato, independent board member, Anna Lewis, independent board member, Sharon Daniel, who is our interim director of nursing quality and patient experience, and Alwena Hughes Mokes, the communications and engagement director. I'd like to go to, before we begin the meeting and review our committee end of year statements, I'd like to ask if there are any declarations of interest. I'm presuming from the no response that there are no declarations of interest to declare. Thank you very much. I'd like to reports for approval and to hand over to Jo Wilson.
So thank you, Chair. So the purpose of this report is to present committee annual reports to the board. So each of our committee annual reports summarises the activities of the committee during 2024, and in those you're able to see how we have met their terms of reference as well as identified any particular work intended for the future year, and to give that assurance to the board. It also is a requirement of our in order to summarise the work of the committee and to identify, as I said, how it's fulfilled its duty. I do want to particularly say thank you to our committee members, committee chairs who have worked inordinately hard this year, as you can see from the reports that are presented in front of you, and particularly to our committee chairs who have written their forward to their reports personally this year, which is a new approach that we've taken. So I've just handed over to each committee chair to see if there's anything they wish to specifically call out from their reports. And I think we're starting with our Chair of Audit and Risk Assurance Committee Chair.
Okay, thank you. Well, I take the report as read. It's a 29-page lengthy report, and it's been another busy year for ARAC. And as a consequence of the scrutiny undertaken by ARAC, a number of outcomes from the work of the committee during the year have resulted in escalation of certain matters to the board. And these cases, the committee has made recommendations and undertaken further actions in order to seek and provide assurance to the board that issues of concern have been addressed where possible, thus supporting the Health Board's governance and assurance system. I think if we look at 2.41, the most significant is the Head of Internal Audit Annual Report and Opinion 23-24, provided an overall limited assurance rating. The audit plan was prepared on the basis of risk-based planning approach, including areas that the Health Board had specifically identified as known risks areas and areas of potential concern. It is considered that the Health Board has adequate arrangements at a corporate level. However, arrangements across areas and services within the organisation show variation, and in total, the Health Board received 8 limited assurance rated reports. On a positive note, 20 reports provided substantial or reasonable assurance. I just want to go perhaps just touch on point 5 with Audit Wales, and I thank Audit Wales for the cooperation and the in all our committee meetings. And I just want to external audit is provided by Audit Wales with its work for falling under the 2 broad headings of audit and financial statements, and providing an opinion thereon, and also the performance audit work, including all Wales thematic review of planned care and local project work. And if we look at 5.4, there are the conclusions from Audit Wales are summarised as follows. So you can see from the board transparency, effectiveness and cohesion, the board and its committee continue to operate effectively, maintaining focus on public transparency, good governance and continuous improvement. The corporate systems of assurance, the Health Board has maintained and enhanced corporate systems of assurance related to risk and recommendation tracking, and there's appropriate board oversight. With a corporate approach to planning, the Health Board has maintained its focus and its long-term vision, and development and delivery of the annual plan is supported by appropriate corporate and board oversight. And the corporate approach to managing financial resources, despite a clear process for financial planning and reasonable arrangements for managing and monitoring the financial position, the Health Board's financial position is extremely challenging for the 23-24 year. Point 7, I've just mentioned the head of internal audit opinion, and 7.2 can highlight that there. Just on 8.3, then the committee received the counter-fraud annual report, and at its meeting held on the 16th of April, the Health Board's counter-fraud provision has demonstrated compliance with the requirements of the Welsh Government direction to NHS bodies on counter-fraud measures. And I want to thank Ben and the team because we have this dialogue and we have this conversation in every ARAC meeting with a local counter-fraud officer. Therefore, quickly going on just to the conclusions, I'm not going to go through the conclusions. I just want to say that there are several conclusions, and these have all been through several times. And I just, on that point, I just want to ask the board to endorse the content of this report as a summary of the work and findings of the Audit Risk Assurance Committee for the financial year of 23-24. Thank you.
Thank you.
And then Chair, I don't know if Derek, sorry, should you just take it out? We'll soon look through them of one at the end. I don't know if Derek wanted to raise anything on charitable funds.
Dennis, is there anything you would wish to raise on charitable funds?
Sorry, I'm not sure. The signal isn't very good in Ceredigion. I don't know if you can hear me very well. It's just really that the report itself gives an insight to the scrutiny and the oversight of the committee itself and of the work of the Hywel Dda charity. And I'm just, as a chair, extremely grateful and privileged to have the work of our donors and our fundraisers within our local community for their support in our fundraising activities. And just some highlights that are in the report, as you can see: Bronglais Chemo Day Unit refurbishment, Arts in Health, neonatal ventilators, just to name a few. And it just highlights the real dedication of our fundraisers and our donors. And I'd really like to take this opportunity to thank our community for that. Diolch yn fawr.
And then we've got Anne Murphy. If there's anything from the Health and Safety Committee you want to specifically call on?
Thank you very much. Can you hear me?
We can, thank you.
Yeah, thank you. There's just a couple of things. There was a change of chair in November 2023. Judith Hardassi became the interim chair of board. So the chair changed at that time. Also, Mandy Riani left and retired in December 23. So there's an interim executive director of nursing quality and patient experience change at that time as well. The biggest thing was that it's been a really challenging year, and we recognise the hard work and dedication of our teams in maintaining services day-to-day basis within our health board due to the RAC, which is the reinforced aerated autoclaved aerated concrete, which became a major incident at Withybush Hospital, and how really strong and effective the team worked on that, and the reports that were coming back to the Health and Safety Committee were very encouraging. And also the work undertaken by the State Department around the enforced notice for the Mid and West Wales Fire and Rescue Service, and the work that's been undertaken over the last 2 years in regards to that. The rest of the report you can see as read. So, the committee is of the opinion that the draft Health and Safety Annual Report is consistent with its role to set out within the terms of reference, and there's no matter that the committee is aware of at this time that has not been disclosed appropriately. And I thank everybody else and everybody who works in the Health and Safety team and committee. Thank you.
Thank you. Alan, if there's anything specific from MLAC you'd like to call?
Thank you very much. No, nothing specific, but in general to thank the team for the work that's been done on this. The Mental Health Legislation Committee is compliant with the duties that's been set out to it. and there was a change of chair when I took the position of chair of the committee in March 23. The rest of the report you may take as read. Thank you very much.
Diolch.
Chantal, if there's anything from our people, Organisation Development and Culture Committee, specifically to call from the new report.
Chantal, can you?
Should we take that one as well, Chair? I don't think Chantal's actually on the call with us yet. Apologies, our Wi-Fi just stopped out there for a moment. Hoping everybody can still hear us. Yeah, thank you,
Great.
Anthony. Sorry about that. We've also then got our Quality and Safety Experience Committee, and Anna sent her apologies today. I'm not sure if Jennifer, as a Vice Chair, wanted to say anything specifically, or again, the report has been fully through the Quality and Safety Committee and approved. So if there's not, I don't know if Jennifer wanted to add anything specifically.
Not specifically, Chair, diolch yn fawr, but as Vice Chair, I'm privileged to sit on this Quality, Safety and Experience Committee to really highlight the things that matter most to our patients and our staff and our communities. And the work of the committee will continue to build its focus upon impact and outcomes in a high support, high challenge approach to our accountability. So I take the report as read, and I thank all the staff and our patients for also sharing their experiences with us. Diolch yn fawr.
Yeah.
Sorry, Chair. And we've got two final ones. We've got Maynard, our Chair of our Strategic Development Committee. I don't know if Maynard has anything specifically to call out from your report.
I've got nothing specific to call out in the report. I'd just like to add, as everybody else has, my thanks to all the staff and everybody who's contributed to the meeting over the year, and just take the report as read.
Thank you, Chair. And our final one is Winston Weir, our Chair of our Sustainable Resources Committee. Winston, is there anything specific you'd like to call to the board's attention?
Not to the board's attention, but I just want to say that it has been an extremely challenging year for the Health Board in financial terms, and that reflects the work of the committee. We've built up a greater understanding of the underlying financial issues affecting the Health Board, which some are unique to Hywel Dda, but many are generic across all health boards. We're going to, for the coming year, focus on the medium-term financial strategy, the savings programme, and recovery of the financial position. I think it's really essential that we make sure that savings and cost avoidance schemes are embedded, but also making sure that we do not compromise patient safety or quality. Just want to extend my thanks to the committee members, especially the finance team, the information team, and all those budget managers across the Health Board, which has contributed to how we've performed in the last year.
Winston.
Yes, thank you, Chair. So that's all of the committees which, as I mentioned, have been approved in their respective committees. So we ask the board if you will approve all of the annual reports that you've just heard from, Chair.
Thank you. Board, are we happy to approve the annual reports?
Happy.
Mm-hmm. Great. Okay. You can report that as approved.
Thank you, Chair.
Great. Could I move to our next item, which is year-end assurance? And I'd like to begin with annual assessment of board effectiveness for 23-24. I'm going to ask Phil to speak to this.
Diolch Cadeirydd, and bore da pawb. This report will have been read by members. It's been reviewed, the details have been reviewed already at board seminar and at our Audit and Risk Assurance Committee, and you'll see the detail of the assessment in Appendix 1. In addition, you'll see that we've undertaken assessments of board committee effectiveness and also the learning from the Audit Wales report into governance at Betsy Cadwaladr, University Health Board. On page 5, you'll see the level of assessment that we made, which is that we are at level 2. And on page 6, you'll see the various levels which give an explanation of what level 2 means on a 1 to 5 scale. I think, this is a base to work from as a board. We are in targeted interventions, the whole organisation, of course. We would seek to improve this in the coming years. Thank you, Chair.
Thank you very much. Thank you for dealing with that in a very honest and open and authentic way. I think what we would hope to aspire to at our next approval is that we've moved up that ladder. Great, thank you very much. Great, can I now pass to Jo Wilson for our head audit opinion and annual report?
Yes, thank you, Chair. So fortunately, John, our head of internal audit, isn't able to join us today, so I'm just taking this on his behalf. Points that I discussed with James is that he just wanted to say to the board is that his opinion this year is a limited head of internal audit opinion, as our Chair of ARAC has already stated to the board, which is lower than in previous years. This is, unfortunately, as I said, this is lower opinion, but predominantly based on the number of limited audits we've had this year, and also the number of limited audits which have been a repeat audit, which the actions haven't been taken forward as agreed. One area James did wish to flag was we do, as a health board, use a risk-based approach to our audit, so we do ask internal audit to work alongside us as a management aid to look into areas of risk and concern. So that does impact on some of our status, but that doesn't take away the number of limited audits we've had this year, which we are now working on to improve the rating of those, Chair. And as the Chair of ARAC said, we've discussed this in draft audit in this committee, and we've also discussed the final report when it was brought to the last meeting, Chair. So it's been information to the board, but we do need to recognise and reflect on this is the first year we have had a head of internal audit opinion that is limited for a number of years, Chair.
Thank you, Jo. I would just add to that it is disappointing we find ourselves in that limited assurance space, having kind of met a standard before that, and I would very much hope that we will work over the course of the next 12 months to restore our position on that and to give assurance to everybody else that we are working hard to meet the appropriate standards within the board. Bill.
So very much support that, agree it's disappointing, and I think as our Director of Governance says, we do ask internal audit to go to areas to help with our assurance processes, rather than send them to areas which we know are already performing well. So I suppose I would suggest that we continue with that approach, that we do need to continue to use internal audit to go to areas where we want to seek assurance, and I would very much support Jess that we would want to see improvements over the next year.
Thank you very much. Can I move us to next item, which is just seeking your advice to just
it's just for information, Chair, from our head of internal audit. Yeah.
Great. Okay. Thank you. Let's do our next item, which is the annual report and final accounts for 23-24. I'm going to ask Phil and Jo and Hugh to comment on the final accounts, please.
Yeah, Terence. This is a large report which includes our performance report, our accountability report, and a full set of our audited accounts. Has been through our audit and risk assurance committee, and I just wanted to say a big thank you to the teams who prepared this, both Joe and Hugh's teams, as I know that this requires a huge amount of preparation. So well done to the teams for doing all of this together. And with that, I'll hand over to Joe.
So if I chair, I'll take the performance report and the accountability report. And I'm not going to go into detail, just for members that are not part of our audit committee. Our audit committee have reviewed both these documents in draft, and they've also reviewed them in the final stage on Tuesday of this week. And they've both been reviewed by their respective chairs of the committees that they link to as well. So just to say, we did discuss them in detail again on Tuesday. There were some minor amendments which we just need to call out to the board's attention from what you've got in your pack that we made on Tuesday as part of the approval. And that was on page 6 and page 55, where we changed the signature from our previous chair to our current chair, which was an item we've now made that. And the request that all the committee has, it's on page 350 of the overarching pack, that for our Director of Workforce and OD, that we put a date when Lisa became the interim Deputy Chief Executive, which we've now done that chair, and also we clarified in terms of the council officer status of our interim Chief Exec, our previous Chief Executives. There was a slight crossover there, so we've explained that now within the document, Chair. So those were the only amendments, and the audit committee did approve both documents and recommend those to board for approval today. And as our Chief Exec said, just also to thank particularly Charlotte in my team, Tracy Price within Hugh's team, and Fiona in the comms team, because they've worked inordinately hard with Hugh and myself to be able to pull the documents together. So thank you, Chair.
Thank you very much, Joe.
Diolch, Cadeirydd. As Chair of the Sustainable Resources Committee noted earlier, it's been a very challenging financial year. And I'm very conscious in looking at the annual report in its entirety that every statistic and every graph within that represents people affected on the other side of that chart. And while we've got a huge amount to be proud of in terms of the services we provide, there is variability in that. And indeed, we are in targeted intervention as an organisation and are endeavouring to improve our performance outcomes and our financial position. It was a very challenging year. The progress throughout the year meant that we resubmitted a plan alongside organisations across NHS Wales in August. So there was a replanning process that went on halfway through the year, after which there was additional allocations that were received by health boards, and we were a recipient alongside others. It led to a very complicated, as a health board, was unacceptable in itself, and it represented a deficit of 112.9 billion. As part of that August process, Welsh allocated us an additional 43 million of conditionally recurrent funding. So there were conditions attached to that. And while that funding has been assumed in our position this financial year, we've not met those conditions, and Welsh Government may well rescind that funding. And we are in dialogue with Welsh Government to see how we can secure that into the future. We also received an additional allocation of 9.6 million, which represented the challenging inflationary environment in which we found ourselves as an organisation, and the energy costs that we saw last year, the significant growth in energy costs we saw last year. So after adjusting for those, our plan, I guess, should have been 60.3 million. And the target control total, which Welsh Government provided us with, was 44.8 million. So our year-end deficit at 65.8 million was 5.5 million more than our plan, and 21 million more than the target control total. And of course, that in itself is a deficit against our break-even duty, and consequentially has an impact on our regularity opinion in that it's expenditure over and above that which the Senedd and Welsh Ministers would have approved. In summary, we have 3 statutory targets and 1 administrative target. So the first statutory target is for our revenue resource limit, and that's the balance over 3 years, which naturally requires a plan to achieve that. Our revenue resource limit, we were overspent by 65.8 million, which took our cumulative 3-year position to 149.9 million. So we breached that target. On capital, our capital resource limit, again, is required to balance over 3 years. We underspent on that in year by 33,000, so we came within our target. The cumulative underspend of 164,000, so again, within that statutory target. We got the duty to pay our accounts, to prepare an annual plan over 3 years, and we didn't pay a plan that was approvable by government. Target. And the last target we have is a target that is to make sure that we pay creditors, those who supply us the goods and services, within 30 days of receipt of goods or services or invoice. And we achieved that. We are required to pay 95% within 50 days, and we paid 95.8%. Our position on revenue represents a very significant challenge, which is inherited and bequeathed into this financial year. It's an unacceptable position, but that doesn't detract from the hard work that I know happens across our system and with colleagues from across health and care. While we did achieve our capital resource limit, capital is also a very challenged resource, and our backlog maintenance at this stage is around 136 million. Actually, is reviewed on a regular basis. At this point in time, it's 136 million. So while we achieved the target, it's within a very significantly constrained system. I don't have any particularly significant issues on the accounts other than the post-balance sheet event, which is noted on note 29 on page 68, and that relates to the medical pay awards. That is an agreement that was reached with unions after the end of the year, but the costs for that relate to the previous financial year. While they relate to the previous financial year, because the liability was created in this financial year, we will be recognising the costs this year. That will be funded by Welsh Government and going through the process of estimating the impact of that at the moment. I'd like to also offer some thanks, firstly to the finance team. Clearly, we have a duty to prepare a set of accounts which are a true and fair representation of the position of the Health Board, regardless of how challenging that is. And I'm pleased to say that's the position we have reached. Also to colleagues across the Health Board working in very challenging conditions, given the demands that we're all facing. In particular, we want to thank Welsh Government for funding the cash consequences of our deficit. That is something that we were dependent upon in order to be able to maintain payments to our staff and suppliers across the system. And to colleagues in governance, the Director of Corporate Governance in particular, who helps me make sure that our expenditure is in line with the rules set out in managing Welsh public money. Also internal audit, who supported us in assessing areas of risk and concern, and external audit for working with us so effectively and with an open, transparent approach, no surprises, to make sure that we've been able to reach this point in time. There is one audit recommendation, which I'm sure Anthony from Audit Wales will raise, around counting stock and managing that process. We're currently rolling out a system that will automate that process. That will take us the next year to achieve. That's a system called Scan for Safety that will address that recommendation as part of that system rollout. With that, Chair, happy to open up to questions.
Great. Thank you, Hugh. Colleagues, any questions or thoughts? No? I would offer my thanks. Hugh, well done. I think we are. I think we're in an extremely tight fiscal position. Actually, last year, I think we are unsustainable currently in terms of the demand placed on the organisation and our resource base. Nevertheless, I don't think that should detract from the fact I think we are accounting well for our resources in these circumstances, albeit we have some way to go to deliver that sustainability as we look to the future. And I count on all my colleagues here to be part of that community to deliver that as quickly as possible. Thank you very much. I'm going to come to Rodri as Chair of Audit and Risk Assurance Committee for any assurance or view he may have.
Good, thank you. And just to start with, I also publicly thanked everybody involved with the accounts as Chair of ARAC on Tuesday. But we have discussed, we have looked at these in detail, and for assurance to the board, I can confirm that all elements of the annual report and accounts, and that is the performance report, the accountability report and the accounts have been reviewed in detail by ARAC in a draft format in early May. I'm content that all required changes requested by Audit Wales and Welsh Government have been made and a robust audit trail retained. Following presentation to ARAC on the individual elements as described above and reviewing the ISA 260 with Audit Wales, I can confirm as Chair of ARAC that the committee approved the annual report and accounts and recommends these for onward ratification by the board.
Thank you, Rodri. I'd like us to take us to our penultimate item, and that is, last but not least, the opinion of Audit Wales, ISA 260 and letter of representation. And I'm coming to Anthony for that.
Thank you, Chair. Can I just check that you can hear me, Chair?
We can.
Excellent. Thank you very much. I'll just stick to the sort of salient points in our report on the audit of the accounts, as you call it, the ISA 260 report, Chair. But first of all, just to keep in tune with what others have said, a big sincere thanks from ourselves of the audit team to the Health Board for their support during the audit. It's a huge task, as you've already mentioned, to prepare the accounts. And then after you've done that task, you've then got the auditors visiting for 4 to 6 weeks as well. So very much appreciated on that front. And a big thanks to certainly Hugh and his finance team, and of course, Jo and her corporate governance team as well. It's a consolidated effort, and one where we try to work in partnership with the Health Board. Just in terms then of our report, I will just, like I said, I'll just keep to the key points. The key issue is that we intend to provide a true and fair position on the Health Board's accounts for the year ended the 31st of March 2024, as Hugh has already mentioned. Hugh already touched upon as well that we will be qualifying our regularity opinion because of the financial position. In terms of regularity, we do check that the monies received by the Health Board were spent for the purposes intended, and of course, as has already been mentioned, that you haven't met your revenue resource limit for the past 3 years, hence that requires a qualification. So we've included a qualification in that respect within our audit report, and we've issued a substantive audit report explaining that matter. And of course, we've referenced the fact that the IMTP has not been balanced and approved as well in that report. Ultimately then, in terms of our report, our audit opinion is included in Appendix 1, and that's now positioned within the annual report and accounts. There's the letter of representation that will require the board to sign today. That will be needed before the Auditor General for Wales signs off his audit opinion, which is scheduled for tomorrow morning. We also include a further appendix, which again has been referenced to. As a result of our audit, we did raise a number of misstatements. They have all been corrected within the financial statements, so nothing remains uncorrected, which is a positive message. And of course, the last opinion is one recommendation that we raised in relation to the need for the Health Board in future years to make sure that it does an inventory check, a stock check in relation to theatre stock at the year end. So that concludes our report, Chair, and relative assurances. Thank you very much.
Diolch, Anthony, thank you very much indeed. We would hope, just in response to Hugh's reassurance around the stock control, that by this time next year we will be in a position to give you that assurance that the system is in place and working effectively, if not before that. But thank you very much indeed. Rodri.
Yeah, just on that last point, the recommendation that you have raised, it is on the audit tracker and there's a clear implementation date of Q4 2025, so that is being tracked.
Excellent, good, great, thank you very much. Any further questions or issues that you wish to raise? No? Great, very much. Thank you again, Rodri. Thank you again, Anthony. That is very helpful. Then to the annual accounts, the final account, the annual report and final accounts. Can I have acknowledgement on screen from independent members, if possible?
We're seeing a different screen, I think.
Okay, so you're fine. Your colleagues are seeing it. Great, okay. Great, okay. Thank you very much. I'd like to now take us to our last item, which is the date and time of the next meeting.
Yeah. So the next meeting, Chair, is the 25th of July, and we will be in Ceredigion.
Great, thank you very much. All that remains for me to say is thank you to everybody whose dedication and time has allowed us to be able to sign off the annual report and accounts today. But more widely, just to thank everybody within this organisation, the 13,500 people who every day come to work and dedicate themselves to delivering an excellent service, even if sometimes that's challenging in the current environment. We are deeply grateful for coming to work to deliver. If there's no further questions or comments, I'll close the meeting. Thank you very much.